So here is just a list of all different types of assays we're doing for fragment screening these days. And I'm trying now to add a new kid on the block, WAC for fragment screens. In the following slides, we're going to argue why should we do WAC. I mean, we have SPR. SPR is very powerful technology. A lot of people working with that. There are a number of other assays, as you can see. I'm not going to go into the details. So we started with that situation, and here is the current technology. We're working with small columns, tiny columns like microcolumns, and also capillary columns, because capillaries are smaller volumes. So what we do then, actually, we just bind the stuff we want to immobilize onto a silica particle. But silica is bad. A lot of things like to be sorbed onto silica. So we had to do a lot of chemistry to actually minimize interactions with silica. So our standard forming today is that we actually make a cyanide silica that carries a lot of groups. And then we just apply it in the standard LC-MS machine. You can work with other detectors too, like UV, but standard setup is an MS machine hooked up at standard LC-MS platform. And here are a couple of electron microscopes I did just a year ago. I was thinking, we have a very powerful microscope in Singapore, and I was thinking, can I see those proteins? Where are they sitting and things like that. But we were not able within my time to do that. But we got some nice pictures of just the silica particle around 20,000. You can actually see, that all these pores you have, because that's very important that you have a porous particle so you can actually immobilize a lot of stuff onto it. So it's microcapillary columns, MS detection, and we're working isocratically. No change in buffer, it's just retarded at different, depending on its affinity. And we have a solvent that's compatible with the MS. So it's easy to volatile. So we are working with ammonium acetate, for example. Volatile buffers. You can also work, if you're really crazy about working with buffers too, but then you have to clean your MS unit so frequently. So it's one of the problems. So data acquisition. We have the reputation here. That's it. It's retarded. We don't dilute it, by changing conditions. And then we got the TR, just the retention time or volume. And after that, we try to see how, looking at something that's going in the void, that's not interacting. And as you know, most libraries are in DMeso. We use then DMeso as our void marker. Even though it can be argued sometimes the DMeso can also interact a little bit. So we have that. And after that, we can do control columns of different types. Blank columns without target, or with an irrelevant target, or something else. I think the best control is actually the target in itself, devoid of its activity we are looking at. But it's unfortunately, we are not in that situation. We can do that many times. So when you have the control column, that gives you some kind of interaction also. And the net of that is then what I call the T-spec here, retention time specific. That's very simple to determine then, for example, the KD. This is a very simple formula. And as you can see, the retention is dependent on two things. The affinity, the more affinity, the more retarded. And also the amount of binding interactions in that little volume we have of the column. And if you know that, then you can get the KD directly. Very simple, isn't it? But for example, you have to run at linear absorption isotherm. That means you have to have a concentration that's low enough so it's not dependent on the concentration, the retention time. But we are typical of that because we're working LC-MS. We can work with very small amounts. So that's it. I'm not going to go into the kinetics. That's a separate talk. But I think the message is that we can handle the kinetics too. And if we can handle that well, it's going to be a really big plus too, that we can actually state we can handle that. So one good example is stereoisomers. But we have found a fragment in the library that giving double peaks all the time. And we looked at well, it's a racemic mixture, and it's different affinities. And here's one example where we found that, and of course everything is 3 dimensions, that actually it's specific for the stereoisomers too, depending on binding. So here's one of the enantiomers binding at 0.16 millimolar and one at 1 millimolar. And I think that's a very good proof of specificity concept, because when we block it, it goes into thrombin is easy because we can block it covalently. So we block the active sites. And what we see remaining here is just binding. And we can call it non-specific, but it's binding to the remaining parts of the protein surface of thrombin. And of course then we have the blank here, in this case with nothing on it. And you see that we still have it binding. For me that represents still binding to the surface of the protein. We have that all the time. We have a lot of interaction to protein surface. And what does that mean? Is it relevant or not? It's up to us to decide. So, good example, stereoisomers. And here's one example from Eleanor's thesis, where we actually worked with 3 targets. Was GAC, kinase target, and chaperone, so we did with Venalis in Cambridge, and also PIN1, which is a, how do you say, PPI target, if I understand it right. So that we did with, also with Venalis in England. And here you can see why all these people. We are working with mixtures, because that's one of the beauties. We can mix everything in one package, because MS can detect every fragment if they are different enough. So we have a barcode on every fragment. So here in this case, maybe we have 10. You can see all these retention times is the individual for each fragment. And the retention time gives you directly then the affinity here. So that's powerful. We have worked up to near 100 fragments in one mixture. So you think about it, we can run a whole library then in a short time. I'm going to show you a slide on that later. Yeah, so here's the case we did with thrombin, and again, we have the retention times, and in this case we were lucky to have a blocked column, so we can actually work with that. So we did this together with AstraZeneca now 5 years, more than 5 years ago in Gothenburg. And here's an example from that paper where we were able to, from 566 fragments done in different mixtures up to 66 fragments in one mixture. We did that, and here you can see the profile of a number of these fragments. But in this case we found a lot of binders. I think it was around 20, 30, and most of them was not specific. We found just, I think, a few cases of specific binder. That means binders actually binding to the target. But this was the first illustration we did on a big fragment library we were using, in this case a 566 fragment library. Now it's chromatography you're dealing with. And one of the beauties with chromatography is that you can work with mixtures. That means you can maybe work with natural mixtures. When you do organic synthesis, maybe you can actually run those mixtures without purifying them directly towards the target. But you do a lot of parallel reactions. And here's one work we did in collaboration with Brian Diamond at the National University of Singapore, where we actually did that, because that I think is a fantastic advantage generally, which no other method can really do. So in this case, we had ASP90 heat shock chaperone as our target. We were working with parallel reactions towards this purine analog here, with a number of different benzyl bromides in one pot. And then we took that pot and just analyzed it without doing anything with it. And it was not affecting our targets as such. So that means we can actually take that pure mixture, crude mixture, inject it in the system and analyze what's going on. So here you can see the number of products here, where they are and what affinities they are. They were substituted at this position here, number of different, and all can be characterized in one shot, the affinities of it. And here is the starting point, we still see that. We can actually discover degradation products, side reactions, and everything. All right, another thing we have been trying to, and this is a big challenge for us, because it's a big market, membrane proteins. Because what is, according to statistics, membrane proteins are more than 50% of all targets. So we did an experiment, a study in Uppsala with Professor Katarina Edwards there, where we actually tried to work with the membrane proteins, integrate it in a lipid environment, and see if we can handle that with WAC. And here is one work we did on aquaporin, which is a membrane protein. And we actually were able to integrate this in discs here. You can see the discs here, and apply that and immobilize that onto column. And then we run a small library of 200 substances, I think, and found at least one good fragment that was binding here at around 5 micromolar. But this is the first example of this, and it needs a lot more work, and maybe that's something I'm hoping to do more in the future, to see that we actually can apply the WAC technology more onto membrane proteins. But it is very challenging to handle this with this technology and other technologies. But I just want to illustrate that we have tried to work also with membrane proteins. Another thing I'm doing right now in Singapore is, because it's chromatography and it's WAC, and if we have the target, maybe we can look for binders in any crude extract. And there are many drugs coming from natural resources. So here we are working with a bitter gourd. It's a fruit used a lot in Asian cooking. And we are actually then looking for binders to this. And we took as a model system, because we have been working a lot with proteases, like trypsin here. And we actually now are finding weak binders in our natural extracts. And it's a totally undiscovered area of all these natural. We discussed a lot, for example, in traditional Chinese medicine, a lot of the effects there maybe are not caused by traditional drugs. We have a combination of weak binders that overcome and give you the potency. And the only technology can do this is basic chromatography, because it's chromatography, it's purifying, and even though it probably still is a mixture, we can purify, characterize it directly. So we can work with all these natural libraries right away. Is a possibility for the future. So here's just an updated list what we have done so far on targets. I'm working on other targets right now in Singapore. So you see here there are a number of examples, but we hope, of course, to make this list much larger. And internally, Johan has been working with ER4, and you were quite happy with these results, what I understand. That actually you find one that was not seen by your other technology, but that was seen by WAC for BRD4. And Eleanor made, a number of years ago now, 5 years ago, a validation study together with the knowledge in Cambridge, where we screened towards each chaperone, each of chaperone 90, where we're screening 111 fragments and validated towards other technologies they were using there at the company. So good correlation with NMR, 88% SPR, and other technologies they used there, ITC X-ray for some polarization and thermal shifts, and you can see the results from them. So this was a convincing study for us that we are actually looking at the right thing, and it was a sort of a validation for us. And we published that in Analytical Chemistry a number of years ago. So, to summarize then, characteristics of WAC screening. First, we can determine the KD ranking with isocratic solution. Up to 3 to 4 orders of magnitude, from 10 millimolar, I think our world record is 20 millimolar, we have determined, up to 0.1 micromolar, where we still can elute it isocratically. Tighter binders are stuck and eluted so late and so diluted so it's hard to see them. But then we can determine them by forced dilution at low concentration, eluting agent. Of course, we have to be aware of that the target have to withstand those conditions and things like that, so it has to be determined individually if you can do that. This is one important argument, because if you use other technologies like SBR, if you're going to see weak interactions, you need to have a high concentration. If you're going to see millimolar, you have to millimolar. All these solubility problems. When we are running MS, we're running low concentrations, micromolar range. So we can see millimolar with micromolar. So we can actually determine one low concentration. If you're going to get the SBR, to get the affinities that, you have to do an isotherm. Throughput, as we're running in mixtures, we can do fast. A whole library, according to my experience at least, we can do within 24 hours. At least get the ranking. Now we're not including kinetics. Kinetics is another story that would take a little extra time. So we can do that. But problems is we can't see all fragments with MS. We have to spend some time to scan. Our experience in our hand that some parts of it, like 1 to 5%, we can't see that easily. At least with the masses I have been working with, for many reasons. Maybe hard to get them to fly and things like that. We can do the chirality, which is good, isn't it? You can't do that with SBR, so still you don't know which one is binding which. Consumption, with the small capillary columns, we are now down to around 0.1, 0.2 milligrams consumption. And if we mobilize them well, they can last a long time. Now, one of the criticisms, of course, to WAC and SBR is, immobilization, now you have a problem. You're going to change it, and maybe you're going to lose activity. And that's true, it happens. I had cases where I had not been successful really to immobilize it well. But it's quite rare. So to compensate with that, you can reuse it a lot. I have an antibody column that's more than 10 years old and it's still running. Quality, this is LCMS. You now have good, robust LCMS, precision accuracy. Remember from my old days with SBR and ELISAs, if I got a CV on 15-20%, then I was happy. Here you have HPLC CVs, 1 to 5%. Robust. And it's not sensitive to impurities because we have control of that. Now, specificity is a big issue for all methods. We can have problems with specificity. We can have background interactions which are irrelevant to the target, but also to the surface of the support, which could be a problem in some cases. And then you have to go around that. And so this is a big issue of specificity. What is specificity, really? For me, it's the definition of specificity is the difference between desired and non-desired interactions. Because you have a lot of interactions even to your target. And we talked about that before, that could be also relevant, if you're going to make allosteric drugs and things like that actually work on other parts of the target that has an potency effect there. Complex samples. I think this is something that can really be valuable for the future. We can work with complex samples. We can purify them. We can characterize them, like I did with the bitter gore here. Right now, I'm characterizing binders to these targets with all methods because we can just fractionate and go to LMR, high resolution MS, blah, 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 to do further characterization of it. It's label free. And we think it's quite cost efficient. Here you can do with something which you already maybe have. Little bit on the ongoing work. More on the complex samples that I would like to do more, especially in TCM, traditional Chinese medicine. And of course, test the kinetic studies we're doing right now that we actually can explore and get the kinetics. We have published 3 good reviews on this the latest years. And with the final slide, I just would like to acknowledge the work we have done through the years. There have been so many people involved. And also this is a picture from when we were in San Diego just a month ago. So with that, I will end, and thanks for listening to me.